Well, I think the first thing to remember is that there are risks at home and there are risks abroad, right? So just because you're traveling does not mean that you're putting yourself at risk. And a lot of the risks that you can encounter abroad, you can actually deal with ahead of time. So much of it depends on your destination. Obviously, if you're going to England or someplace in Western Europe or Australia, most of the time you don't need to worry too much about travel-related risks because those parts of the world are very similar to our part of the world here. But for some parts of the world, we do need to worry about things like shots. And it's not just shots specific to that destination, but making sure that you're up to date on your routine shots, like tetanus, for example, or flu shot, in part because you may be traveling to a part of the world where medical care is difficult to access or may not be up to the standard that you're used to. And then there are destination-specific shots, such as Japanese encephalitis virus for parts of Asia, yellow fever vaccine for South America and parts of sub-Saharan Africa. So those shots would be destination-specific, and you wouldn't really know which one to get unless you talk to a travel health professional. It's also really important to inform yourself about how to prevent foodborne illness, because foodborne illness, otherwise known as traveler's diarrhea or Montezuma's revenge, that is a very common illness to befall travelers. And it's actually relatively easy to prevent. I mean, I like to tell patients that cooked food is your friend. If it's been cooked, deep fried, then that's okay. Raw food that has come into contact with water that may not actually be safe is dangerous. Or sometimes people's hands who are preparing your food may not be clean. Cooking will inactivate most, not all, but most germs. But if it's raw, like a salad, a fruit juice, something like that, that could definitely transmit disease. And then finally, malaria is really important. Malaria does not exist everywhere, but a travel health professional will know if where you're going is a place that's endemic for malaria or not, and what you could take to prevent malaria. So you talk about mostly your destination in terms of what the risks are to you. So of course we think about infectious diseases, and for many parts of the world, the travel health professional will take a look at the map, go over your itinerary with you, and then talk about infectious diseases that you may be at risk for, such as rabies or malaria, and then counsel you about how to prevent those particular infections. But there are other things that people don't think about so much. A travel health professional will talk about how to prevent mosquito bites to the best of your ability, how to prevent sunburn. When we travel to different parts of the world, actually we are at greater risk for sunburn that we may not be aware of since we're used to living here in Seattle. But if you're near the equator, of course, you're at greater risk for sunburn. Altitude sickness would be another thing. And then depending on the patient, there are specific risks. For example, if they're volunteering in a refugee camp, then they would be at more risk for certain diseases such as cholera, or they may be at risk for certain sexually transmitted diseases, and there are actually ways to prevent or at least decrease your risk of acquiring HIV infection and so forth. So some of it depends on the destination. I would say most of it depends on the destination, some of it on the individual, and also on what the individual is going to be doing while they're over there.